Happy Sunday, everyone. Today we'll be talking about giving first aid in crisis, and we'll be using a war situation as a case study here. What is first aid? First aid is the treatment you give to a person, the immediate treatment you give to a person before the arrival of full medical treatment. And to give a first aid, you don't have to be a medical professional. It is a skill we should all learn so that we can attend to injuries in situations like this one we are looking at. You can attend to injuries in an effective and calm manner. And in this situation, we'll be looking at 5 wounds, 5 injuries that can result from crisis, and then we'll be looking at how we can manage them. Let us remember that whatever we do in under first aid is aimed at promoting wellness and prolonging the life and preventing the situation from getting worse. So first we'll be talking about stab wound. Stab wound is common in crisis or during war and what have you. And we all understand that stab is using a sharp object. It could be knife or broken bottle or any sharp object to penetrate into somebody's body. And how do you manage when you are faced with a situation like this? What can you do as a first aider? The first thing you do is to call for emergency help. In a situation, in a place where this is not available, an alternative is to make arrangement for transport, how to transport the person to the hospital. Because really there are some things that you cannot do. There are some situations where you need medical help to actually save the life. So first aid is just to hold the person's life, to keep the person alive while that is ongoing. So you want to make arrangement for help, for transport to the hospital, and while that is ongoing, the next thing you want to do is arrest bleeding. Of course, in stab injuries, there will be bleeding. So you want to try as much as possible to stop the bleeding. And the way to stop bleeding is apply pressure. Any type of bleeding at all, the way to stop it is applying pressure. And you do that by using a piece of cloth. You can use a piece of cloth, place it on it, and put your hand on it firmly. Or you can wrap the clothing around the particular wound, the injury, to stop it from bleeding. And I want you to note this, that if the sharp objects, be it knife, is left in the injury, please do not remove it, because they actually serve as plug there. Of course, the knife would have penetrated into some vessels, so removing it is like unplugging the vessel, and that way there will be more bleeding. So when the knife or the sharp object is left there, you apply pressure on either side of the object. Like you put your pressure on the sides. You don't touch the object at all. The next thing after you've applied pressure is to elevate the part. If it's a hand or leg, say for instance a person has been stabbed on the hand, you raise it up above the level of the heart. That as well can stop bleeding. So, and if it's the leg, you can as well raise that. But if it's the tummy, for instance, you can elevate the tummy. So if it's a place you can elevate, please elevate, and if you can't, it's fine as well. That's what you do for stab injury, because bleeding is the only emergency thing at that point. The next one I'll be talking about is laceration. Laceration is simply a cut through a skin, a tissue, muscle, what have you. So when there is a cut, the emergency thing there is bleeding as well. But in this situation, there could be debris or dirt in the cut. So you want to rinse that out first before applying pressure. So you simply put the wound under running water and let the running water flush out the dirt. Then you apply pressure the same way you do for the stab injury. Then once that is done, you can give painkiller, paracetamol or anything to help the person feel better. And the third one I'll be talking about is a fracture. We understand fracture is a break in the bone. When there is a broken bone, that is fracture. So what do you do in situations of fracture? You are not straightening the part. You are not, for instance, if the hand has been twisted to the other side, you are not going to try to straighten it at all. No, you are going to keep it still as it is, and you will even try to do that using a cushion, a cloth to support on either side, just to be sure you are keeping it still to avoid further damage. And once that is done, of course there will be swelling if there is fracture. What you want to do next is to get a cold compress on that part, and you do this with ice pack, or with, if you can't get ice, you can get very cold water. For instance, a pure water, very cold one, you wrap it in a light cloth and you place on the site. This will keep the place. This will help to avoid swelling. Next, when you've done that, you can give if there is bleeding in situation of fracture, in situation of an open fracture, there could be bleeding. So if there is bleeding, what you want to do is to apply pressure to stop bleeding, and then you can give painkiller, paracetamol or any stronger one if the person is not allergic to it. Another injury that can result from crisis is bones injury. In situation of bones injury, the first thing you want to do, don't forget one thing, the first thing you always have to do is to call for help. While that is ongoing, then you start your own first aid treatment. So what you want to do here now is to help the person from the fire or whatever it would have caused the burns. So you remove the person from there, and when you are doing this, you have to be careful, because you have to be careful not to put yourself at risk. So once that person is removed from that place, the next thing is remove all the clothing the person around the burns area. So remove all the clothing. If the person is wearing jewelry, you remove it. But if there is any jewelry that is stuck into the wound, like stuck into the surface of the bones, please leave that there. It's just the way it applies to when knife is stuck into a stab injury as well. So you leave those, you remove all that clothing, and after that has been removed, you keep the part or the person under running water and let the water cool off the person's body. Please do not use cold. We are not using chilled water or hot water. It is just normal lukewarm water here. And once that is done, you want to keep this person warm, because when there is an open in the skin, the body temperature falls below normal. So you want to keep this person warm as much as you can. And while doing this, be careful so the clothing doesn't stick to the surface of the wound. So once this is done, another thing you can do is to put a cling film instead of if you can find that around. Of course, nylon is common everywhere, you know, the transparent thin nylon. Just place it on the wound. You are not wrapping it around or doing anything special. Just tear it open like just a layer and place on the surface of the wound. Please do not apply butter, grease or anything on the wound. Just do that and keep the person warm, and you can give painkiller and make the person sit upright if the face is burnt, to avoid swelling of the face. And lastly, gunshot injury. Gunshot injury always has entry and exit point, so you check both to see which is more severe and attend to that one first. And one thing that is common in gunshot is, of course, bleeding. So you arrest bleeding the same way I've addressed earlier. You apply pressure, elevate if you can to arrest bleeding, and if the bullet is in there, do not remove. Please keep it there. I think that's all you have to do in cases of crisis if there is injury. And there is another thing that can occur to in any situation of crisis, even without injury at all, is shock. You know, the uproar, the fear and everything can even cause a person can cause a person to start breathing abnormally. And this is when you have to do CPR to keep the person alive. CPR is cardiopulmonary resuscitation, and this is a teaching on its own. If maybe next time I have the chance, I'll be happy to talk on this. But for now, these are all you have to do in situations of gunshots, laceration, fracture, or the 5 I've talked about. Thank you. God bless.